Hello, welcome to Orthopedic Splinting with Chef Spencer.
And Darren, magnifique!
We will be going over the techniques for building the perfect splint today. Welcome. Alright, in order to make a splint, you need many things.
The first thing you need the towels because we are going to make a mess.
And with the towels, we will have the water for the mess and to help make it so that the splinting material gets nice and hard.
And then you have the padding, so you can make it nice and soft for the patient.
And then to keep the splinting and the padding on, we have the batting.
And the tape.
If you work in a fancy hospital, you will have the ortho-glass, and then you do not have any other thought processes now.
But here at Denver General, we use something called plaster.
And with plaster, we have to think about other things. The first is, how many layers of the plaster do we use? So each layer of the plaster is very thin, and we must stack them on top of each other.
And so to make a proper splint, you are going to need 7 to 12 layers of the plaster.
Very nice. This is fine grade plaster, this is.
Magnifique.
Okay, now I am the patient with the broken arm. Oh, my arm is broken.
Oh, I must measure for a splint. Here, let me grab this.
Oh, my arm, it hurts so much.
Oh, wait, maybe I should measure the other arm.
Oh, that feels so much better.
I measure with my batting, and then I can just tear very easily. Then I have a good measurement for how much splinting material. We will show you how to use padding for an ulnar gutter. The principles for padding are to place as much padding as you possibly can over all bony prominences. So here on the wrist, you get a nice thick amount of the padding. You come an appreciable way up the arm, and then you can tear. But we want to make sure that we have padding in all of the parts where you can, bony prominences that could cause pain. You can always add extra padding as such.
Oh, it's very nice, it's very nice.
So now we get to the part where we make the big mess. We are going to be using our plaster.
So for the plaster, we are going to put it in the water. If the water is really hot, it will make the plaster really hot, which can burn your patient, which you do not want to burn your patient. You want to cook them to the perfect temperature. If it is too cold, it will take too long to set up. So you want the water that is lukewarm to make sure that it sets up at the proper speed.
So you take your plaster, it goes in the water, and then you do the dip, and then you do the strip.
And the strip is to take as much water out of the plaster as possible, because once it is activated, the more water, the longer it will take to set up. So now Chef Darren is now stripping it very well. And then he sets it out. Now you can use the towel to help dry it out some, and especially with ortho-glass, that is very, very good. So for our splint we are putting on now, for our demonstration, you can see that we just get it wet and then we mold it over the top of the arm. So we get it in the position where we want it, not over the padding. So there is a little bit of a buffer so that the plaster does not cut into the skin itself.
So to finish off our splint, we next use our batting, and it goes around like this. We always go distal to proximal. If you hold your roll like this, it rolls on nice and easily without pulling. You don't want to pull lots of tension on your patient.
We leave it nice and loose because the swelling we know is going to happen. So we put the splint on to allow the swelling to happen.
And then I cut.
Cut. And we can cut the video.
Finish off with the tape. We make sure that we do not do circumferential tape that will cut off the blood flow. But you want to make sure that you are going to keep your splint intact, just like this. Mon Dieu! I did not do a timeout. I have put the splint on the wrong arm.
This was my broken arm the whole time. Okay, we are going to talk about the reasons that we splint. The first reason is that we put the hard substance on the bone to make sure it does not fall out of place after we do the reduction. The second is that we put the patient in a place where they will not get the very bad contracture as they heal up. So we are going to go over different splints we can put on different parts of the body. All right, we are here with our patient who has broken his ankle. So we are going to put on the appropriate splint for that, which is a posterior slab on the backside. And here is our splinting material. So we will lift it up and we are going to run it from just below the level of the knee to just below the level of the toes. And we will hold it there. While your assistant holds you there, you are also going to put on a stirrup. And the stirrup goes around the edge of the leg, like so, and then it hopefully does not break like our pasta splint does here, and you hold him here. Now, once you are in this position, we need to make sure we mold the splint correctly. So I'm going to put the patient's foot on my chest, and I'm going to push it so it is at the degrees of 90 degrees right there, and I push with my chest. Then I take my upper hand and I put it here. And then I take my lower hand and I put it on the outside of the ankle and I push in to try to put the ankle back into the appropriate location. Just like this. And then I hold it for a very long time until it settles up.
So now we will work on a broken wrist. We are going to work with the sugar-tongs. And so I make my sugar-tong and it holds. Oh, my dude.
Ah, no, keep the sugar-tong on. Wait, what is going on with the sugar-tong?
I want to make my tongue of sugar.
And then just keep it there. And then I hold, and then you hold, and then there must be an easier way.
There must be a better way.
Luckily, we have a better solution than the sugar-tong. We have the
reverse sugar-tong. And all you need is a simple cut here. And now it makes a magnifique wrap that goes around.
And it is very strong from here. And just a little more detail here on the distal radius fracture, because they are usually shortened on the radial side, and because they are usually dorsally angulated, we pull the thumb up forward a little bit, and we pull it through the ulnar side, which is called a thumb hold. Like you take the thumb and you hold it up in the air like that, and it gives the counter traction to the way the bones are broken and holds your reduction in place. Okay, we have another patient, and he has broken a bone in his hand here that we need to splint with the ulnar gutter. So the ulnar gutter goes on the ulnar side of the arm. It goes up to the almost the tip of the pinky, and it goes over the PIP of the fourth finger, and it goes here. Now we're going to do a couple things with it. We are going to bring him into the intrinsic plus position, which is the wrist back at about 20 degrees, the fingers flexed between 60 and 90 degrees, and this keeps tension off all the ligaments. So as he heals, the ligaments do not go into contraction, which is one of our goals here. So we put him into this position, and then Darren is going to show you the next step.
The other goal is to not have him bending his arm out of position there, so we can get a good neutral position just by having him hold flat on a surface, and then he can even Hold.
Very nice.
yes.
That is very nice. Very nice indeed. Okay. Now let's say the little punk decided to punch a wall and he has the boxer's fracture. So for the boxer's fracture, we do very simple thing now. Go ahead and come off the splint there, young one. We just do the butty taping, and the butty taping makes him feel much better, and we say stop punching the walls, and then we are good. It doesn't need a splint for the boxer's fracture. We are just going to highlight the intrinsic plus position one more time. The nice thing about it is that the ligaments stay elongated, so when they are in the splint, they do not become tight and get the contracture. All right, we will finish up today with the thumb spiker.
So the thumb spiker, you take your casting material and you wrap the thumb.
You can see now that this will actually drape it, so it kind of rolls around the front of the forearm with that.
And you finish in act of new friendship, you give the bro shake.
The bro shake is the perfect way to make sure you mold it in the correct location. And that is our splinting for today.
Wow,
Thank
great
you.
French accent.